reproductive organs. It contains main parts are uterus, fallopian tubes, ovaries, cervix and the vagina. First we will discuss about the uterus. This is the structure of the uterus. This uterus is a pear-shaped organ and it is made up of columnar epithelial tissues. And the length about the uterus is 3 inches length and 2 inches width and 1 inch thickness. And this uterus also contains 3 main parts, that is fundus. This structure is called as the fundus and this structure is called as the body of the uterus, and this is the cervix. 3 main parts, fundus, body and the cervix. And uterus also contains 3 main layers. The outermost covering layer of the uterus is called as perimetrium, and the middle layer is called as myometrium, and inner layer is called as endometrium. Perimetrium, myometrium and the endometrium. This endometrial layer also again divided into 3 main parts, that is outer layer, middle layer and inner layer. This outer layer is called as compact layer of the endometrium, and middle layer of the endometrium is called as spongy layer, and inner layer of the endometrium is called as the basal layer. This is about the layers of the endometrium. And this, what are the main functions of the endometrium? This endometrium is having main function for the implantation. The blastocyst is implanting in this place, especially in the endometrium. If implantation is not takes place, this endometrium, okay, all blood, it contains more blood vessels, and this all blood vessels are damaged and destroying from this place, and it is flowing like a menstrual blood. That is the endometrium main functions. And what is the main functions of the uterus? This uterus is having main functions is menstruation and pregnancy and implantation. These all are the main functions for the uterus. And next we will see about the fallopian tubes. From the uterine body, 2 sides we are having 2 tube-like structures, that is called fallopian tube. This is one fallopian tubes and this is also one of the fallopian tube. It is also contains 4 main parts. Okay, the starting part of the fallopian tube is called as, means it is a junction between the uterine body and the fallopian tube. This structure is called as isthmus. And middle of the middle part of the fallopian tube is called as ampulla. And next one is, okay, this end part is called as infundibulum, and this finger like projection part is called as the fimbria. These all are the main parts of the fallopian tubes. 2 sides we are having 2 tubes, and also 2 sides of the fallopian tube same parts we are having. And next we will discuss about the ovaries. Each side of the uterine body we are having 2 ovaries. So what is the main function of this ovaries? In this ovaries there is a presence of the female gametes. In this ovaries there is a presence of the ovums. So what is the main function of this ovums? On after menstrual cycle 14th day, means from first day to 14th day, from this ovary one ovum is releasing, that is called ovulation. Okay, after releasing this, for example, one ovum is releasing on 14th day. So what is happening? This finger like projection structure is there, 2 sides. Okay, for example you can see this side. Okay, this finger like projection structure, that is called fimbria. These fimbrias are holding this ovum. Okay, ovum is entering into this fimbria structure and then it is moving to the next structure, that is called infundibulum. After ovulation, the ovum is, okay, entering into the fimbria. Why? Because this fimbria is a finger like projection. It is catches the ovum and it is transferring to this ovum into the next part, that is called infundibulum. Okay, and after that this ovum is moving towards to the ampulla place, and this ovum is, after reaching to the ampulla, it is waiting for this sperm. Why? Because mostly fertilization is occurs in this ampulla region. Okay, so that's why this ovum is egg, okay, is waiting for the sperm. During the same time, maybe this, okay, woman is having sexual contact. Okay, sexual contact, this semen is deposited into the vagina and it is entering into the cervix, and this semen is reaches to the, okay, fallopian tubes, and finally it is reaches to the ovum. How it is reaches to the ovum? Okay, why? How this sperm is knowing this side, only this side is only, which side is egg is there? Why? Because this egg, this ovum is releasing some type of chemicals, chemical attractants. Okay, due to this attractants, this sperm is directly moving towards to the ovum. This is not moving, most of the sperm is moving towards to the ovum only. Why? Because it is releasing some type of chemicals. It is called chemical attractants. Or very few sperms are moving this side also. Okay, so that's why due to this reason there is a fusion. Fertilization takes place in the ovum site. After fertilization, okay, second day it is forming like a 2-cell division, next it is forming like a 4-cell division, and next it is forming like morula, and finally this fertilized egg is reaches to the endometrium, and here implantation takes place. Okay, that is the implantation. If implantation is not takes place, okay, this fertilized egg and this endometrial layers, everything is damaged, collapsed, and it is flowing like a menstrual flow. Okay, that is the main function of the fallopian tubes. Okay, and next we will discuss about the cervix. This cervix also have made up of muscles, and this cervix also having two parts, endocervix and exocervix. Endocervix means this is the part, endocervix means it is present inside of, means it is touches, it is having connection into the uterine body, and exocervix means it is outside, means it is having connection into the vagina. Okay, that is. And next one is the vagina. Already you know what is the main function of the vagina. Okay, this vagina during the sexual intercourse, it is allows the penis, and okay, and also it is allowing the menstrual flow. Okay, these all are the main functions of the vagina, and this is the main structure of the female internal reproductive organs.